Hello, my name is Christine, and this is day 2 after my surgery. This is Friday. I had my surgery on Wednesday, and I have been thinking and thinking since I got here of what I would say here on this video. First, I do want to say you're probably watching this because you want to investigate, you want to learn, you want to research, and that's what I believe in. That's what I do, and I am such a strong advocate of researching and finding out facts for yourself. Do not just rely on your doctors, whoever they are, neurologists, general physicians, interventional radiologists. Keep researching as much as you can. Let me back up a little bit. I had to make notes, but some of you may have seen me on the CCSVI.org page because I have a video patient perspective that I did there. And I remember that was in March of last year. And I remember talking and thanking all the IRs for fighting for us, because if it weren't for them, CCSVI would not be in the forefront as it is now. But I also remember in that video saying that it worked and it's wonderful and I'll do it as many times as I have to do it. And what I've learned now is, no, I won't. That's not a good thing. I can't help but, because I'm a lawyer, once a lawyer, always a lawyer, got to insert the legal jargon. You know, this is my opinion. I'm not a doctor. I can't give you medical advice. I'm blown away by these doctors here. The time they take with you, and their knowledge. I mean, I come in here thinking, okay, I kind of know some stuff. Absolutely not. These doctors know so much and understand, and they want to move research forward and see it move forward, but see it done in the right way. You've already heard how everybody has talked about the great care. I mean, I ditto that. I'm not going to keep going on about the great care. Other patients have told you that. It's second to none. Everybody's so wonderful. And I'm not going to kid you, this is a very hard journey. This is not for everyone. I understand this. This is a big step, an extreme step, to have surgical intervention, to have someone, that's what I kept saying, slice into my neck and then slice into my leg. And my best friend would say, could you use a different term than slice? And I'd say, well, how about fillet? And then that didn't work either. But I mean, seriously, to have someone cut into your neck and cut into your leg because you have MS, because whether you know it or not, you are living in a constant state of hopelessness, and it's subconscious. You don't even realize it. And that became so clear to me, of course, as the brain fog was gone. It became so clear to me after the surgery. You don't even realize it. Even though I'm a positive person and I'm fighting, there's just this constant state of hopelessness, this constant state of vulnerability, and you want to beg for anybody to do something to help you as you just watch your body slip away, and you know in your heart that's not who you are. So why did I take this step to come here? Well, just to give you a little background, I had my first CCSVI procedure done in September 2010. It was done through the Hubbard Foundation. Dr. Saxon did that surgery. And 2 days after that surgery, I was walking around the San Diego Zoo, up and down hills. Now, the day before the surgery, I was being pushed around in a wheelchair at Legoland. 2 days after the surgery, I was up walking. I walked through the airport. I didn't need the wheelchair. I was riding. I ride horses. I was riding my horses again. I was walking a straight line. I was showing off to everyone how I had my life back. And I said, never in a million years would I wish this on anybody. But for people to lose it and get it back, the appreciation you have for little things you never even thought about, that was so wonderful. I knew without a doubt that treatment for CCSVI was real. And I didn't really understand all of why it was real, why it happened. But I think like a lot of us, we didn't care. It worked. We don't care if it's treating our MS. We don't care if it's treating our CCSVI. What it's doing is getting rid of this prison of a body we're in. So I was in heaven when that happened, like many people were that had treatment. And then it wore off. And that was hard. But that's okay because I knew it worked. So I made an appointment to go back out again. And then I went back for my second treatment in December 2010. And I didn't get the same results. And I feel like maybe it kept me stable. I didn't keep going down. But I didn't get the same results where I was walking with all that energy and feeling like I could stay up forever. After the first surgery, one of my friends, I was telling her, look at all the energy I have. And she said, now we're going to have to give you Ritalin. So after the second surgery, I didn't get those great results. And then finally, I went for my third surgery. Now, I'd already had the left upper jugular opened up twice, but I have a blockage up high. I went for my third surgery to see Dr. Sclafani. And the reason I chose that is because I knew he used IVUS, and I thought, well, let's just bring another tool into this. So I went to see him. He put me on the table. He looked at my left vein, and he was so deflated. I am so, so grateful to him because he said, I'm not going to touch it. There's nothing I can do. I've looked at your films. It seems to be getting worse every time after each treatment. And the fact that he didn't touch it and he didn't do another procedure and damage the vein even more is quite possibly one of the reasons that I still could do this. What ends up happening, as I've learned, is each time you have this angioplasty, you are damaging the veins. And if it works once, that's great. But it wears off, maybe because there's inflammation in there and scarring, and that's why it wears off. Maybe it didn't work in the first place because you just reacted to scarring. I don't know. I'm going to leave that to the doctors to figure out. And that's what I've said to the neuros before when I was sitting there talking to a neurologist from University of Chicago, and then I was talking to some IRs, and I said, you guys are the scientists, you're the doctors, all I know is it works. You figure it out. You figure out why it works. So everybody's still trying to figure it out, but what I'm seeing is people getting procedures over and over again because we're all chasing that high again. We're all chasing that first time. Well, I finally saw a post because we're all on Facebook. That's how we all know. That's how I learned by word of mouth, and then you meet everybody on Facebook. And I saw Jan Wexler post about Excel Hospital and about the surgery that she had had. And that really piqued my interest. Of course, I follow all the research like many of us do. So I started looking into it. I contacted Tina, talked to her. I remember right where I was sitting. She helped me get in touch also with another patient, Deirdre, who had the procedure done. I spoke to Deirdre forever. And I was saying to my husband, well, if we're going to do this, maybe I'll do it, let's see, later in the year. And we'll do it maybe October, November, get through the summer. And I talked to Deirdre, and she told me about the results she was having. And she said, why wait? You owe it to yourself. Give it to yourself for your birthday. I just had my birthday last week, June 13th. This will be your birthday present. So that's what I keep saying now, is that last year I got a cute little used convertible for my birthday, and this year I got a new jugular vein. I just started learning after seeing Jan's post and talking to Tina, and she explained to me what happens and what Dr. Hernandez does is he takes a vein from your leg and he builds you a whole new vein. And then he goes in and he attaches it. Not pretending. I don't want to pretend that I wasn't afraid, because I was very afraid. The first day, all of the appointments had the neurologist. Wait, it was Dr. Hernandez, and it was the cardiologist, Dr. Macias, and the interventional radiologist, Dr. Rodriguez, and then we had Melissa, the nutritionist. Those of us that have had the angioplasty when it worked, we know it worked. That's what this is going to do, and I'm willing to take that extreme step. I'm willing to do it for me. I'm I'm willing to do it for my family. I'm willing to do it to move the research forward. I so much want the doctors to not get involved in all of the politics and the ego wars. I'm probably asking for too much. But the neurologists fighting, not agreeing with the interventional radiologists, and then even the interventional radiologists, they don't agree on how things should be done in treatment. Treatment should not be done repeatedly, okay? I'm a lawyer. I'm not a doctor. I'm not giving advice. Get angio once. Find out if that works for you. If you have a stenosis, maybe you have a compression, and angioplasty is not going to work. Dr. Rodriguez is saying if you have something above the upper third of your jugular vein up towards the top, maybe don't treat it, because you've got to leave a stump there so that surgical intervention will work. Because I had surgical intervention, or because I had 2 angioplasties, it was very stenotic. So when he attaches it, we hope it doesn't continue to be stenotic or create more stenosis. If I hadn't had those and just went straight to surgical intervention, I know Dr. Hernandez believes no problem then with the attachment. There wouldn't be a problem with stenosis. But it's the repeat procedures. I really think that everyone needs to do their research and learn. We want this so bad. We want to be helped. And of course we want it to be easier. Taking a pill is easy, but in the long run it's not. Research that's going on with remyelinization. There's research going on even here, I know, stem cell research. I know Dr. Terry Walls is doing research on diet. That's another one. I follow her diet very strictly. If I'm going to get my neck cut open, I'm going to follow it up. I'm going to be all in and feed myself healthy foods and take good care of myself. I absolutely 100% believe that the foods that we have fed ourselves have poisoned us. When over the years we thought they were good for us, what they were doing is messing up our blood and causing all of these issues. The world is trying to do, or certain doctors are trying to do everything they can to cover up this venous connection. But I realized not too long ago about what I had done. I will tell everyone I can. Maybe it's not for everyone, but watch me. Watch what I post on Facebook. I will tell you the truth, if it works, if it doesn't work, if I'm going forward, if I'm going back. But boy, it's been a long week, and it's been a journey of a lifetime. And I don't regret it for a second. I would do it over in a heartbeat. Fortunately, I don't have to, because my right jugular vein looks wonderful. So I guess that's easy for me to say I'd do it over. But my right jugular vein is wonderful. So at least I have that going for me. But my left was a complete mess. My collaterals were huge, something I had all my life. We have to find out ways to diagnose this early and find ways to treat it and not be over-treating and ruining our chances for success in the future. So that's it. Thank you for listening to me. I hope I didn't bore you too much. I hope that you do your research. Please call Tina, research this, ask me questions, ask other people questions. This is the only way that we're going to get the word out there, is by the patients, not by the doctors. Although I do thank them all. They did a great job. Thank you.